Really what we're talking about is how diabetes affects the blood vessels throughout the entire body. Because basically chronically elevated blood sugars, which is what diabetes is, damages the lining of the blood vessels throughout the entire body. The retina is one of the few places in the body where we can look directly in there and see that damage going on. And so just a little bit of damage, the retina is so fragile, it's such a fragile tissue, just a little bit of damage to the blood vessels can wreak havoc. The blood sugar damages the blood vessels in a couple of different ways in the retina and throughout the entire body. And actually, by the time we're starting to see damage in the retina, your internist can pick up damage in your kidneys, in your feet, in your nerves, and elsewhere in the body. So what we see in the retina is kind of a barometer of what we see going on elsewhere with the blood vessels throughout the entire body. But the damage that occurs initially usually is just some mild damage to the lining of the blood vessels, which then the blood vessels don't hold the blood and the serum in, and it kind of leaks out into the tissue and causes the tissue to swell. And that would be diabetic macular edema. Edema means swelling. And that is one manifestation of diabetic retinopathy, or how diabetes damages the retina. Sometimes, and particularly with younger age onset diabetics, the blood sugar damages the blood vessels so badly that the blood vessels just close off entirely. When that happens, the retina tries to heal itself by growing new blood vessels, which sounds like a good thing, except these new blood vessels are very fragile and they break and they bleed. And when they bleed, it can be a very catastrophic bleed, very sudden cataclysmic bleed.